And immobilization, Gary can tell you, we've talked to him for years. We're going to get rid of backboards. We're going to get rid of backboards. They were never intended to be used 100% of the time, and that's what everybody was using. Well, as we go around the industry now, New York and other people have gotten rid of backboards except for certain circumstances. They were designed to put under somebody's butt, to slide them out onto a field, move them over to a mattress, and take care of patients. And now we put them on things like vacuum mattresses. Comfort is the king, not the backboard. It's just a tongue depressor on steroids. Okay? So combinations of what they have with vacuum mattresses and combi carriers, easy to remove people. Our biggest nut to crack now has been the hospitals. And I was just with some doctors the other day and I said, how do you get around this? Because the crews say, we're not using backboards, but the hospital staff is used to seeing it. And the medical director said, we went to them and told them, tough shit. You ain't seeing backboards anymore. Get used to it. Because you know what you people do? We bring them in on backboards, and you take the backboards off anyway to put them on your soft mattress. So we're just going to take that extra step away from you. We're going to clear their spine if they have any indication of a significant neck injury, not just somebody who has neck pain. Then they're going to be on a full backboard, perhaps. So that's the perfect fit. And that collar's too large. We always taught people you have to put the right size collar on, but what if it's too large? If it's too small, you move around. That's no good. Well, here's what the Eagles showed from Houston. That's a C3, C4 distraction, meaning there are no bones connected there. Okay? And it's called an internal decapitation. And I want you to notice what's happening here on autopsy to see what the cervical collar did. One was the patient lying supine. The second level was when they had a collar on, and the third is when we tried to intubate them. The crew killed this patient with a cervical collar. She was young, healthy, doing fine until she got to the emergency department and she died of spinal shock. Okay? You see this lady? She looks fine. You put a cervical collar on her. I guess I didn't have that slide in there. But what you would see if I had the other slide in there is that when they put the wrong size cervical collar on and there were no bones attached, they were stretching her spinal cord and killed her. So we don't have to do that. People like Los Angeles City and others are using vacuum mattresses. This one happens to be from Hartwell. And you fold it around, you mold it, put a piece of tape across the forehead, and they're happy as a clam.